Did you know that almost 90% of women in the United States will get an epidural when they're in labor? I'm here to tell you all the pros and all the cons of getting an epidural in labor. So let's go. So what is an epidural? An epidural gets its name for the place in your spinal cord where they inject the medications. So in order to get an epidural, you have to be able to sit still, which if you've had a baby before, you know it is very difficult to sit still for this procedure. Typically, you can only have one person in there with you. They will wear, a little cap, and they will prep you sterilely, which means they will use very sterile technique to prevent infection while they are putting in the medication. So they'll put some antibacterial thing on your back. They'll put a drape over it, and they will find the epidural space. They will put a local pain relief, so you won't feel the needle going in. You may have some pressure, but you put the needle in and then they'll put a catheter, which is a tiny tube through, so it's not a needle in your back, it's a catheter. So that catheter will stay in so that if they need to add more medications later to top you off, they can do that. This whole procedure takes about 20 to 30 minutes. But it's good to know that the anesthesiologist might be in the operating room. He might be busy doing other epidurals for people in the hospital. So you might have to wait, depending on the size of your hospital too, might have to wait a while before you get that epidural. So I always recommend even if you plan to get an epidural, to have backup coping methods to get you through that time. I saw studies that said up to 23% of epidurals fail.
23% of epidurals fail.
So this means that they're not working correctly, and only a smaller percentage of them can be fixed with position changes or things like that. Not to scare you at all if your plan for pain management is the epidural, but just know that prepping for the pain of labor and coping techniques is always a good idea. If you want more resources on this, remember to follow me on my Instagram, subscribe to this channel, and stay tuned for some more resources I have on comfort measures in labor. There are two big pros of getting an epidural. The first one, obviously, is pain relief. For most women, the epidural will relieve most of the pain of labor. You still might feel some pressure, which actually is a good thing when you start pushing to really connect with that pressure that you're feeling. But for the most part, all the pain will be relieved. On the other hand, another pro is the ability to rest. Because you aren't having to actively cope with every contraction as they come, you can take a nap, which is amazing. I do like to tell this story. Some women call it the epidural nap, and I've seen that. I was supporting one of my friends in the hospital, and she was at 6 centimeters. She had been up for almost 48 hours, just so exhausted. She got the epidural, she was able to sleep, and then she woke up being 10 centimeters and ready to push, which I just think is awesome. And a positive epidural story. And really, the best use of it is when you're exhausted, and that is the next best step. And I would encourage you, even if you are planning a natural unmedicated birth, which if you know me, I'm such a proponent for. I love physiologic birth and just supporting moms who want to go unmedicated. And I have actually, most of the births I've attended have been unmedicated. But I think it's important to just have a general idea of what an epidural entails in case you decide in your labor that that's the best next choice for you. Now let's talk about the cons. In this section, you might be overwhelmed because there's a longer list of cons than there are pros, but I think it's just, again, really important to be informed on the risks and the benefits of any intervention. So the biggest con for me as a doula who supports birth is the restriction on movement. Movement is so key to helping labor progress, and having an epidural, you need to stay in the bed because you are numb from your waist down and it is not safe for you to be out of the bed. I posted a video last week on best labor positions, even if you have an epidural, using the birth ball, using the squat bar. So I would definitely recommend you go check that out if you want more resources on, hey, like if I get the epidural, like it's not good to be laying flat on your back, but what are positions I can do still in the bed? Another con comes when you start to push. So a lot of moms I've seen have problems when they get to the pushing stage because while you have some pressure, you can't really feel what's going on. This is when I see moms maybe use a mirror so they can actually see like what they're doing when they're pushing and what is actually happening down there. I mentioned the failed epidurals when they aren't working correctly, but you can also have something where the epidural is only effective on one side. And usually to remedy this, the nurse or the anesthesiologist will come in and help you move to one side or the other so the medication can kind of like drip down, I guess, like, and impact the nerves on the other side where you're not feeling it. But a lot of women I've heard, who have told me their stories of this happening to them, they were like, it was the weirdest sensation and almost harder to cope with because it was only like on one side. So a good thing to know that there are ways to potentially mitigate that, but it is a potential side effect. Speaking of side effects, let us go down the long list. I will put maybe a list here just so you're aware, but I'm going to touch on kind of the biggest ones that I see. One that I think is the most crucial one to know is that you might have low blood pressure. So, you have blood that's pumping through your heart into the rest of your body. So if you have low blood pressure, the issue is that your body tries to protect your vital organs first, and it moves the blood away from the placenta, which is giving oxygen and nutrients to the baby. So this can impact the baby by slowing down its heart rate, what's called decelerations, because it's being deprived of oxygen. If not enough blood is having the pressure to be pumped out to the placenta. So typically if they see you have low blood pressure, they're going to give you some extra fluids, they're going to change your position, but this is a very huge side effect that could put baby in a compromised state, which could be an indication for a C-section delivery. Another side effect is maternal fever, so you spike a temperature. So this is because the epidural can disrupt the thermoregulation center in your brain, so how your body regulates your temperature. But typically when you have a fever, they think that you have an infection, which is possible in labor. So they will just usually give you Tylenol, or if things look concerning, again, it could be an indication for a C-section delivery. If you've taken a childbirth class or have experienced childbirth yourself, you probably know that nausea and vomiting are pretty common side effects of just labor and all the hormonal things that are happening in your body. But it is a side effect of the epidural, as well as itching. And this is a side effect of what is in the epidural. I didn't say this earlier, but what is in the epidural, it varies from hospital to hospital, but typically it will be fentanyl, which is an opioid, and then some kind of medication that ends in cane, which is a local anesthetic. This could be lidocaine, ropivacaine, different cane drugs. If you look at the bag, if you do get an epidural, you can see like what is in their specific formulation, but like I said, it does vary. The itching is a very common side effect of an opioid based drug, which is what an epidural is. So that is something to keep in mind. And a lot of moms just don't like the fact that it does have fentanyl in it. It technically only a small amount goes into your bloodstream, but lots of moms, which I totally get, are just concerned that that's in there. Things to know as well is that you will need a catheter placed into your bladder because you won't feel that urge to pee. There is a potential of slowing down your labor. This isn't universal, but it does happen. So you might need other interventions like Pitocin or fluids or things to get things going. This is a rare side effect, but some moms have permanent nerve or spinal cord damage from the epidural insertion. This can also manifest as chronic back pain or just different issues. And it's rare, but it still can happen. So I just wanted to inform all of you. And yeah, it's just very sad that that is kind of what women have to deal with in relation to getting an epidural. So I know that was a lot of side effects, cons for the epidural, but I just think that all of those things are just important for you to know so you can be fully informed before labor if you are faced with the decision to get an epidural or to not get an epidural. All in all, getting an epidural is a very personal decision, and it's up to every mom to make the best decision for themselves and their family, and I just hope that you can feel truly informed. And I created Sunset Birth to help moms feel peaceful, prepared, and confident for birth. So subscribe to this channel, follow my Instagram, and keep tabs on my website for more offerings to help you just be as well prepared as you can be for birth. Let me know in the comments if this helped you. I want to hear your epidural stories, things that you experienced that maybe I didn't mention in this video, because I just think that there's so much value to women hearing other women's stories. So thank you for watching. I'll see you guys next time.